Welcome to 2-Minute Anaesthesia in Critical Care. Let's discuss the Bling 3 trial 2024. What is the main question in this trial? It questions, in critically ill patients with sepsis, does continuous versus intermittent infusions of β-Lactam, either Tazocin or Meropenem, lead to an improved mortality? This is based on the fact of time-dependent killing, whereby I look at the graph drug concentration versus time, and it's a time above MIC, minimum inhibitory concentration. How was this achieved? It was an international study of 140 ICUs, open label phase 3, over a 5-year period. At least 18 years old, patients were starting either Tazocin or Meropenem with a strong suspicion of infection within 24 hours of ICU admission, with at least one or more organ dysfunction in the previous 24 hours. The physician chose the antibiotic dose, and they were either randomised into continuous, i.e. 24-hour infusion, or intermittent bolus, i.e. 30 minutes. Antibiotics were continued until discharge or course completion. 29,000 patients were assessed, 21,000 were excluded. This resulted in 7,000 who were under randomisation into intermittent or continuous infusion. In both subgroups, there was equal demographics, admission routes, Apache scores, and disease burden. The most common infection was pulmonary at 60%, followed by abdominal, blood, urine, skin. The results. The primary outcome. All-cause mortality at 90 days, not significant. However, adjusted for pre-specified factors including sex, Apache score, and admission pathway for continuous infusions led to an absolute reduction in mortality by 2%. Number needed to treat 50. Secondary outcomes. Clinical cure at 14 days in favour of continuous infusion, which was significant. New acquisition and colonisation of infection, including multi-drug resistance and C. difficile, was not significant between both subgroups. And finally, tertiary outcomes. Dead or alive and free of ICU, hospital stay, and IPPV and renal replacement therapy was not significant between both subgroups. Adverse events were infrequent, 10 in the continuous versus 6 in the intermittent. The serious one was in the continuous group, which resulted in severe encephalopathy, which was thought to be due to elevated levels of CSF meropenem, which led to a cardiac arrest and death. The strengths. It's a large randomised control study worldwide with large cohorts with a feasibility in phase 2 trials. However, it's non-blinded. There's no clear diagnosis prior to randomisation. Some patients may be on more than one antibiotic, for example, Tazocin with addition of additional antibiotics, and is mainly high-income ICU settings. This was followed by a systematic review and meta-analysis of 17 studies in adult ICU patients in sepsis or septic shock with prolonged β-Lactam antibiotic infusions led to an improved 90-day mortality and clinical cure. Once again, thank you for listening.